What are advanced directives for stroke patients? Imagine facing a sudden stroke that leaves you unable to speak or make decisions. That's where advanced directives come into play, helping ensure your wishes are respected even if you can't communicate them at the moment. These are legal documents that you create ahead of time, outlining your preferences for medical care if you become unable to do so because of the stroke or its complications. They serve as a guide for healthcare teams and family members, making sure your values and choices are honored during critical moments. One common type of advanced directive is the living will. This document specifies what treatments you want or do not want if you are unable to express your wishes. For example, you might state whether you want to be resuscitated if your heart stops, or if you want a breathing machine if you cannot breathe on your own. You can also specify your preferences about feeding tubes or other life-sustaining interventions, which are often important considerations for stroke patients who might face swallowing difficulties or severe brain injury. Another key component is the durable power of attorney for healthcare. This appoints a trusted person, often called a healthcare proxy or agent, to make medical decisions on your behalf if you lose decision-making capacity. This person is responsible for ensuring your treatment aligns with your values and wishes, especially when you cannot communicate them yourself. Some patients choose to have a Do Resuscitate Order, or DNR. This order tells medical staff not to perform CPR or advanced life support if your heart or breathing stops. For stroke patients with a very poor prognosis or severe brain injury, a DNR can be part of their advanced care planning, helping avoid unwanted or non-beneficial procedures. Medical orders like the physician orders for life-sustaining treatment or PALST are also used. These are specific instructions that accompany your advanced directives and are designed to be easily understood by emergency medical personnel. They clarify your preferences for treatments in urgent situations. Having advanced directives is especially important for stroke patients because strokes can happen suddenly, causing loss of consciousness, cognitive impairment, or paralysis. Without these documents, families and medical teams might face difficult decisions without knowing what you would want. By planning ahead, you help ensure your care reflects your values, reduce stress for loved ones, and avoid unnecessary treatments that you might not want. Hospitals typically review your advanced directives when you are admitted, and healthcare providers will discuss your wishes with you or your family. If you do not have an advanced directive, medical teams may rely on legal guardians or family members to make decisions based on what they believe is in your best interest. Overall, advanced directives are vital tools that empower you to control your medical care, even if you cannot speak for yourself. They help guide treatment decisions, promote clear communication, and ensure your care aligns with your personal goals. It's always best to discuss these options with your healthcare provider early, ideally before any health crisis occurs, so your wishes are known and respected. Remember, each person's medical journey is unique, and having a plan in place can provide peace of mind for you and your loved ones.